So my name is Nathalie Deleuge, and I'm one of the global project leader at ECO. So let's start to talk about Mycoplasma and its economic impact. So here, as you can see on the graph, mycoplasmosis, which is affecting chicken and is mainly used by two bacteria, Mycoplasma synoviae and Mycoplasma gallisepticum, is ranking number 6 in terms of disease causing economic impact in the poultry industry. If we focus on Mycoplasma synoviae, it is well known that MS in layers is causing a delay in the onset of the egg production, as you can see here on the graph in yellow with the MS positive flock, and this has a direct impact on the economic return for the producer. If we have a look at the table, so a MS positive flock produces less eggs per hen and more B grade eggs as compared to the MS negative flock. The feed conversion ratio and the mortality rates are also higher in MS positive flock as compared to MS negative. So the direct impact of the presence of MS is about 21 eggs per hen. But if you take all the parameters together, the economic losses due to MS, it can reach more than $3,000 per 1,000 birds. So now let's talk about ECOVAXXIN MS, which is our Mycoplasma synoviae vaccine. So ECOVAXXIN MS, it's a live vaccine, and it contains the strain K58858, which is a naturally attenuated US isolate. This vaccine strain was proven to be safe at high dose in young chicken, and it is also free of antimicrobial resistant genes. We have performed many efficacy study, and we have shown that the vaccine is able to reduce air sac lesion and colonization, as well as foot pad lesion caused by MS. We have also shown that the vaccine prevents ovarian regression and the egg production losses caused by MS. We are very happy to announce that ECO has entered also an agreement with Callier for the manufacture of ECOVAXXIN MS and ECOVAXXIN MG. Callier is a Spanish company founded in 1968 and is part of the Inducan Group. Callier's main activity is the development, production, and promotion of veterinary specialty, and their GMP certified plant is located in Leon, in Spain. At the last R&D day, we were presenting this slide to show you the progress that we have done with the tech transfer to Callier. So in the last year, since the last meeting, we have completed then the qualification of all the equipment, as well as the cleaning validation of the facility and the storage of the material and product on site. We have continued with the process knowledge and the training of the ECO personnel. But most importantly, we have completed the analytical transfer of all the assay we will need for the release of this product. We have produced the working seed. We have scaled up the manufacturing process, and we have produced a couple of batches, which is now in our stability program. With one of the batches that we have produced at Callier, we took then ECOVAXXIN MS to the real world. So we have conducted a field efficacy study in Europe, where we had two groups, one group vaccinated with ECOVAXXIN MS at 4 weeks of age, and one with the market leader at 5 weeks of age. And we have observed the birds for 90 days. We have observed them for mortality, body weight development, and seroconversion. So as you can see here on the table, the mortality rate was extremely low for both groups during the 90 days observation period. So we were at less than 1% in both groups. The body weight development were very similar in both groups. And we have also taken some blood sample from the chicken to see if they were expressing MS antibodies, and both groups were reacting the same way. So taking together, these results show that ECOVAXXIN MS perform as well as the market leader in the field. So now that we had all the data package, we prepare a dossier, and as Afid was saying it in this presentation, we have submitted the dossier at the beginning of the month, and this was a really great achievement for the team. So now having these dossiers in hand, we will plan the submission in Mexico, in UK, and in India, And the team currently is preparing a gap analysis to see if the data package is complying with all the requirements we need for Brazil. Once we will have the EU approval, we will also supply the dossier in other LATAM countries as well as in Asia. So now let's talk about our US approval and the delay we are facing. So in fact, the main reason why we are facing delay with the USDA is that they have a lot of additional requests. And we are currently mitigating this setback. And as Afid was explaining, this setback is not specific to our product. We are hearing from other veterinary vaccine companies that they are facing the same situation with the USDA. So to give you a little bit background, so each time that we do submission, we are often getting requests back from the USDA. For example, we were providing a publication showing how long the MS vaccine is surviving in the environment, but the USDA wanted really specific data with our vaccine strain, so we needed to do the study. They asked us a safety study in mice, knowing that MS is not affecting mice. They asked us the sequencing of the complete genome and not only of the few important genes for virulence as we had initially submitted. They asked us also to compile a very extensive risk assessment on the vaccine strain. Moreover, we have submitted an efficacy study where we were showing that the vaccine works perfectly fine, but the USDA decided not to accept this study because they were of the opinion that our control bird didn't show enough disease and therefore that the validity criteria was not met. So we are currently redoing that study. But the biggest challenge we are facing here is that only a small proportion of our submission were reviewed within the official 90 days review timeframe. And since the review process is sequential, we need to have the approval of one piece of information that we have submitted before we can go to the next activity, and this is even aggravating the impact of the delays. Nevertheless, we are doing all we can to answer very fast the USDA request, and we are planning to receive the approval in 2026. So now let's talk about ECOVAXXIN MG, which is our Mycoplasma gallisepticum vaccine. So Mycoplasma gallisepticum, as it was already explained by Simon, it's a chronic respiratory disease in chicken, and it's especially a problem when the flock are stressed or when there is the presence of other respiratory pathogen. So it's ranking number 9 in terms of top 10 disease in cage pullet in the US. Worldwide, the losses are estimated at $780 million, and only in the US at more than $140 million annually due to mortality and production losses. Our solution to this situation is ECOVAXXIN MG, which is a live vaccine containing the strain K6067, which was isolated from a turkey in the United States in 2007. It is a naturally attenuated isolate, and we have proven that this vaccine strain is safe for chicken and turkeys. This vaccine strain is also free of antimicrobial resistant gene. We have produced now a master seed. It is tested and approved by the USDA, and now we are currently running the clinical program that I will explain in the next slide. So the first thing we have done is really to test the safety characteristic of the vaccine strain. So first, we have given the vaccine strain to young birds at 4 weeks old, and we have shown that this is very safe for the birds. We did the same with very young turkeys, 4 weeks old as well, and it's also safe for the turkeys. And we also have done the safety in quails. We know with the requirement of the USDA that we need to have a safety in mice, so we have done it, and it's also safe for mice. We also run a reversion to virulence study, meaning that we have given the vaccine strain to a group of birds and then let this propagate it to another group of birds at several in vivo passage. And we have shown that the vaccine strain is not reverting or increasing in virulence. And we have also run the complete genome sequencing, and I've also showed that it's genetically stable. So taking all this together, we have shown that this vaccine strain is very safe. We have also run an efficacy study for Europe, what we call an onset of immunity, where we have two groups of birds, one group which was not vaccinated and one group vaccinated with ECOVAXXIN MG at 4 weeks of age. And we have challenged both groups at 8 weeks old. 2 weeks later, when they were 10 weeks old, we have done the necropsy. And what you can see here is that the vaccinated bird have really a less air sac lesion as compared to the non-vaccinated birds. We have also checked tracheal thickness, which is a good measure to know if there is tracheitis, depending on the thickness of the trachea. And we have shown that the birds vaccinated with ECOVAXXIN MG has less thick trachea as compared to the control. So taking all this together, ECOVAXXIN MG is efficacious against encephalitis and tracheitis when administered at 4 weeks old. I already said that ECOVAXXIN MG will be produced at Calais. So the assays are now all validated, and we are in the process of transferring them to Calais. The product will be a lyophilized product, as you can see here, and the stabilizer in the lyophilization process is also well defined. And with some of the batches, we have run a stability study. We are reaching 9 months now, and we have a very strong stability of this vaccine. The stability program is still continuing to achieve the shelf life we want. So there's still a lot of work to do on ECOVAXXIN MG, so the year will be busy. So at the beginning of the year, we will complete the tech transfer to Calais with all the assay. We will produce the working seed, and we will scale up. And in the same times, then, since the efficacy study I have shown you is specific for Europe, we are currently starting a study for the USDA who prefer to have a pen design with more birds. So our efficacy study specific for the US is coming. We will also complete the duration of immunity study by the end of the year. We will produce the batches at Calais, and we will enter the field in Europe in the second part of the year, and we will do the same in the US at the beginning of next year. So we are planning the EMA submission in Q1 next year, and our last USDA submission should happen by May 2026 next year.